Hi, this is Alison Savory from One Acupuncture. This is the first video I've recorded, so please bear with me. I have an important announcement to share with you about the clinic reopening. First, I must tell you, I have really missed my patients and being in clinic, and these are difficult times. The practice has been suspended since the 20th of March 2020, so we're close to 2 months already. I am very grateful to have been able to help and support a small number of people with virtual online AcuPress Plus sessions, which is based on acupressure, and also with herbs. And actually this means that I've been able to help people now across the country, which is great. But I miss my practice in Barnstaple and I miss my patients. So just 2 days ago, I cannot tell you how happy I was when my professional body, the British Acupuncture Council, announced that its members, myself included, could reopen in a limited capacity and for urgent care cases. Now, BACC members have been granted this because we are accredited by and part of the Professional Standards Authority, which is a government organisation which makes sure that we practice to a certain standard of care. And I have to tell you, when I found out this news, I properly cried. That I can go back to clinic, use my skills, help people, and just get back to practice. So, we had a long 2.5 hour meeting on this with the BACC yesterday, and I've been going through all the supporting guidelines and protocols to make sure I'm safe and legal to reopen, and we're calling it that I will be COVID-19 secure. Now, before all of this happened, the practice was already compliant with the BACC Safe Practice Guidelines, and I also have a licence to practice from North Devon Council. And if you're looking for treatment, I think it's really important, especially now, to make sure that wherever you're going and whoever you're having treatment with has the right set of licences, the right set of insurance, and is working and adhering to the right set of guidelines. So now I have even more guidelines and safety procedures to put into place. And I'm working really hard on this. I've spent over £1,000 on safety equipment, including new HEPA air filters, one with ultraviolet light, a large order of masks and other PPE equipment, and I've spent many hours in trainings and meetings about this too. But the most pressing question for you is, what does urgent care mean? Now, the short answer to this is that there isn't one. It relies on my clinical judgment, so there won't be a list of I can treat this or I can treat that. It's going to be on a case-by-case basis, and I have to perform a risk assessment for every treatment. You won't be able to book these online because I need to speak with you and assess if there's an urgent need for treatment. But I'm going to give you a couple of examples which might help. It may be that you're in severe pain and your condition is likely to get worse if you don't have treatment. It might even mean that you end up in hospital or needing some other care if you don't get a treatment with me. It may mean that you have severe stress and anxiety or other mental health issues, and not having treatment would result in a deterioration. So if you think you need urgent care, please get in touch and we'll talk about it together. And it will be open for urgent care cases from Tuesday the 2nd of June. Now, if you know anyone else who is in need of urgent care, who hasn't had treatment with me before, I am very happy to talk with them. I'll assess if I can help them, and their first consult will be virtual, and then they can come to clinic. Now, clinic will be running at about 50% capacity for the foreseeable future, with one person in clinic at the time and no waiting area. I'm also going to ask you to not bring anyone with you, please. The rooms are going to be alternated, so there's time for cleaning and settling, and there's air filtration in place. When you come, I'm going to be asking you to put your belongings in a covered box and to bring those in with you, and to wash your hands outside the clinic with hand gel, which I'll give you, and also to put on a single-use surgical mask, which I will also give you. And I'm also going to ask you to remove your shoes. I'll then take your temperature with a non-contact forehead thermometer before you come in. And I'm going to be wearing a face mask too. And each treatment room will be cleaned and sanitised after every visit, as you would expect. Now, there's more details than that, but don't worry about those. I'll make sure you have those before every appointment. For example, I'm going to ask you to confirm 24 hours before your appointment that you and everyone in your household is COVID symptom free. but just ask me if you've got any questions or concerns. For example, you might be in a vulnerable group. You might be anxious about coming back for treatment. So just call and ask me. So another key question is going to be, when will the practice fully reopen? And I'm afraid I don't know that yet. No one does. I am planning for the 7th of July, all being well and dependent on the government relaxing the lockdown laws, but we're just going to have to wait and see. It may also be that we have periods of being open and then needing to close again, but be reassured at all times I am following the government guidelines. So for usual care patients, current and new, I'm reopening, hopefully, and booking the calendar from the 7th of July for face-to-face appointments. So what am I doing in the meantime? I'm offering you virtual consults on Zoom or Skype online, where I can take you through an acupressure session. I'm calling this Acupressure Plus, Acupress Plus, because you still have your full diagnosis, your treatment plan. I select easy to access points which I then coach you on, and we practice together, and then I send you a summary sheet along with any other advice that I would be giving you. I'm also offering online herbal consults and also herbs which are then couriered to your door. If you have never tried herbs before and are interested, please get in touch and we can have a chat. I am deeply thankful to be able to offer this amazing medicine, and I'm seeing some fantastic results. It's a great way to have treatment in these times. A little every day makes a great deal of sense. And I also want to say here, if you do have symptoms of COVID-19 or viral lung infection, or if you are suffering from post-viral fatigue, which I'm seeing more and more of, then I am recommending herbal medicine. I've spent several months having specific training on prescribing for this, so just ask me for information. So, this is a very little but very positive step, which I'm very happy to share with you. Last night, I actually had my best night's sleep in 2 months, and I woke up and I knew I'd been dreaming about giving acupuncture treatments. So I am very happy to get back into clinic to help people who need urgent care. So if that's you, please just get in touch. Thank you.